Hello, guys. Welcome to the SOY podcast. So, today we are with Neeraj Kothari. He's an entrepreneur, co founder of Cogniant. He's based in Sydney right now, and also my cousin, for which I'll be calling him Bhaiya. So, today we'll be talking about tech in mental health. Before we dive into it, can you please, Neeraj Bhaiya, tell us a little about yourself, where you grew up, and what did you study, and how did you reach here, and etc.
Sure. Hi, Yash. Thanks for having me here. Really excited to be on your platform. It's amazing, and thanks for this initiative. I come from a small town in India called Amalner, which is probably not many people know about it. It's on Maharashtra-Gujarat border. So I grew up there, studied, went to do my engineering in Pune. So studied engineering, electrical electronics, and didn't really think much about tech or entrepreneurship. Back then, I mean, you can tell I'm an old guy, but back then I was more interested in looking into how some of these engineering solutions can solve big problems in big corporates. So as usual with Indian family and Indian family pressure, I had to get a corporate job, which I did, work for multinationals, consulting companies, which took me to Singapore, spent 10 years there, worked with a lot of different industries, but in last 10, 12 years, I've been working in healthcare technology, mainly through the consulting companies, which I did work for. I was fortunate enough to be part of Singapore government's national healthcare strategy and their plans towards the technology development. So I was part of the foundational team, which brought the national EHR system for the government of Singapore, which created one patient, one record for the whole country. No matter where the patient, which hospital or clinic they went to, they could pull up their health records and their history so that it minimizes a lot of errors from clinicians and doctors' part. So that was really good experience for me as a young engineer to go through that and just immerse myself to get more understanding of how healthcare works in developed countries and how it is so much different from what we are used to in India. So that's been my background. Since then, I just took it on to develop solutions in healthcare because I thought it served a larger purpose in terms of improving end user and patient lives. Rest of the industries are there are very few industries like this where you could see end user impact happening. So I like doing that, and that's how I ended up shaping my career around healthcare technologies.
So you would say that this was your motivation, or your motivation was something else, or some incident, or something happened that you chose this, like the thing you're doing right now, the
So
company.
so it was both. We interviewed a lot of clinicians, stakeholders in healthcare through these consulting programs, and I ended up joining the government of Singapore Ministry of Health to drive their national healthcare IT strategy
Okay.
and look in. And we talked to a lot of stakeholders, interviewed them, a lot of patients, interviewed them. And through that, we found this unmet need. And also personally, like my friends, they went through a highly stressful period of youth. And if we just contextualize in terms of Indian youth growing up in the Indian society, they generally have a high stress environment for education. And once they're and in education, either they go through really competitive exams or a stressful period where they're trying to prove. And a couple of my friends did that. They went to IIT, and then I heard not so good stories from IITs because all
Yeah,
the
yeah.
smart people coming together also created a lot of stress and highly pressured environment. So that was one. And then second is this youth also went and started looking into relationships. They started having relationships in college, workplaces, and they started having first breakups and first
Yeah.
heartbroken. And that was another thing which the youth was not prepared for in my generation, at least what I knew about. And also, there's this high stressful period people have to go through for marriage as well. So there is nonstop high stress, high pressure environment the youth had to go, and nobody teaches that in school, or nobody talks about it in colleges. And
Yeah.
people have to kind of face on their own, try to figure out their path, and everyone ends up figuring out, if they can figure out or they don't figure out. And that's just sad environment. So I had awareness of that, personal experiences, also other friends going through these experiences, and at the same time I was working in this environment of healthcare technologies. So it all just converged together, and I along with my other co-founder Maureen started to take a plunge and then start building solutions which could help solve some of these problems.
What does Cogniant actually do? Like, it's an app, it's a website also. So, what does it actually do, and where are you based right now? I have heard that you have been in Singapore and now you're in Sydney and you're looking for expanding as well. And so, what does it do actually?
Yeah, so we realize the awareness for mental health is very low in Asia Pacific in general. So India, yes, but also Asia Pacific, Singapore, other Asian countries, there's very low awareness of mental health. And if we were to improve something, we decided let's start measuring that in an objective manner. If we want to improve somebody's health, we should start having a objective or standardized measurement of that health. And unfortunately, in mental health, there's no blood test for depression. There's no X-ray, MRI for depression or stress. It is all very subjective based on questionnaire. A doctor gives you 9 question questionnaire, and you answer that question. Based on that, you get diagnosed if you have depression or not, and which is very subjective. It's not very scientific. And my engineer within me thought it's a broken process. So if we want to create more awareness, let's start with measuring the problem first, and then we'll go towards implementing some of the solutions for those problems. So we are at the first stage of measuring these mental health conditions such as depression, stress, other neurological conditions like chronic pain, dementia, because there's no scientific method yet to measure it. And how we are doing that in Cogniant is using digital biomarkers to measure it. So a modern human being is always on their smartphone. It's the easiest thing for them to access. How can we use smartphone sensors such as voice, camera, activity, movement data to understand mental health better? And we were really we saw like initial results from our clinical trials in Singapore. Those were promising, and now we are doubling down on that, expanding our clinical trials into from Singapore to Australia. So we started from Singapore, but we grew organically. We got some interest in Australia, so I moved to Australia a couple of years back and started setting up our clinical trial sites and partnerships in this part of the world.
So I've been reading about this, Bia, ki there is a like it's most about many companies and most people are doing this, which is about data. They're collecting data and then they are analyzing it and then they'll be creating studies and etc. So what do you think? How secure is the data? How secure will be the data for, because this is a very sensitive information and security will be a lot of a bit of a concern, I think, for people to many people have to share this kind of information for people you were telling about those tests. So I've taken some tests because of I had anxiety and I had depression and stuff. So I had taken those tests and those were I don't think those were shared with anyone, but this will be shared for studies and everything, which will be.
Yeah.
Yeah.
So there are frameworks in Western countries and developed countries, also in Singapore, Australia. There are data privacy, data security frameworks which are implemented. We have to be, we are in a regulated industry, so we follow those regulation and protocols. So in US, there is a HIPAA, which is a healthcare data privacy regulation. In Europe, there is GDPR. In Australia, there's Australian privacy law. In Singapore, there's PDPA, which is personal data protection and privacy laws. So we make sure that our solutions are compliant with this privacy law. And what ends up happening when these records or these data sets go for research and studies, we anonymize it end to end. So the patient identity is taken away and we assign an anonymized ID to that patient so that that is protected. It's encrypted end to end and anonymized for doing further enhancement and development. And just if so, in India, I think it is coming in big way, but it also will get implemented where the end user is protected and is not being exploited for the benefit of advertisements or other things. So being in healthcare itself means it's a regulated industry. So that's why we have to be really careful about the patient data protection and cybersecurity and privacy. And that's, yeah, so we exposed ourselves to the toughest regulation and standards, and we are building based on that. We are a regulated software, and our next step is to go through the FDA software medical as a device certification so that we are validated from the highest authorities and it's more trustworthy solution.
True.
Yeah.
So what I was thinking was that this is a global problem, right? There are like many things happening, and India is obviously one of the biggest. And but this is a global problem. The mental health issues are growing, and with the studies and statistics I've read, or like they show that it will be a growing problem for the future generations as well. So what do you think that digital things like of course, your website and your applications and other mental health applications and mental health tech solutions which are available out there, what do you think the benefits of those are, or what kind of problems are there that still need solutions?
Yeah, so I think the biggest benefit of tech solution is the accessibility and scalability of those solutions. So it is accessible. There are more than 3 billion people who have smartphone around the world. It's more common than toilets around the world and running water. So with having some solutions which are scalable through smartphone just brings that benefit to billions of people from day one, right? So if you can really scale these helpful technologies and solution to really broad, wide audiences. And the other part is there is always shortfall of trained clinical workforce. There are not enough doctors, there are not enough nurses, there are not enough mental health trained professionals. They're either available in only the cities or they're really expensive to access. The benefit of technology is creating this scalable solution at a lower price point where you don't have to pay $200 for one consultation session with a trained psychotherapist. You can do for really low cost. And that's the benefit where it almost creates a democratization of healthcare access to wide masses of population. Yeah, so that's the biggest benefit. And then the second is, of course, with technology, we have an opportunity to not just sustain business as usual, but to disrupt this business as usual and look at new ways of solving existing problems. And through Cogniant, our approach has been that is to disrupt the old methodologies of looking into the same problem and creating more augmented solutions which can take the science forward. Yeah, because now we can with technologies. There are a lot of there's not a lot of new data which is coming up, which the medical textbook or medical professionals don't know what to do with. But that data is really useful. Now we have an opportunity to shape that discussion with the technology.
Right.
Yeah.
So I've always heard about tech and mental health, right? Tech creates problem for people, like many people like me as well. Many a times social media or other things used to create problems. Like it was always uh, this is quite a common debate for a long time, that tech has created problems, and that has helped increase like the mental health issues. Not helped actually, that has caused increase in the increase of mental health issues in like people around the world. It's a long debate, and I think it will continue for long as well, because they'll try to find a balance. So you're finding solutions with tech for mental health actually, like you and many other people are trying to find solutions for that. How do you think is that going, and what's the future of it? What do you see like people doing in future about this?
Yeah, I think it's an unfortunate situation, especially with social media platforms proliferating without any regulation and without putting their users first. They always try to optimize for generating more revenue, and that has created huge societal impacts. So there is no denying that the youth has become more distracted. They have a short attention span. They have more mental health issues. They have it has just created another parallel mm, sort of population, which if not given proper attention and guidance, can create a lot of socio-economical issues. Having said that, there is also now growing awareness in major economies that this can't go unchecked. They are trying to bring few regulations and improvements to solve that. But having said that, we can't blame this on tech. It's a problem created by social media and few other industry players. Tech by itself has actually improved the society and brought more benefits of technology to serve the population. So just detaching that, few bad actors shouldn't be blamed for the whole industry. And I strongly believe if tech can cause problems, it can also fix the problems. So we are on that tech for good movement, where we are also looking at, well, we are not going to get tech away from anybody, and tech is always going to be there just because it's so accessible and convenient to masses. How can we use the existing tech to make better decisions, smarter choices, healthier population? So that's what we have been at it, and I think I'm encouraged. Generally, things are moving in right direction. It's all got accelerated during COVID, when hospitals were shut down, clinics were shut down. People use tech to get their routine care, and that has had huge impact, and it's gonna create lots of momentum in countries like India and others, where tech is going to be more and more integrated in daily lives. People don't go out to get medicines anymore. They get delivered medicines, they get delivered blood test. So it's all moving in the right direction in terms of where tech can help improve the health impact.
Yeah, right. I'm also on the optimistic side as well on this. Like tech has helped a lot, and of course there will be problems, and we have to find a balance between those things. We have to create a lot of awareness, and then, as you said, that you need to regulate things in this space, basically, for like the problems that are being created by the social media apps or by the entertainment applications or the platforms which are available, whichever is there. You need to have some kind of a regulation for those things. And as the metaverse and web3 and etc., those things are that are coming ahead, we need to think about the regulation first. Like as some Sundar Pichai or maybe I think Satya Nadella said this about the like regulation of AI as well, that we are just scratching the surface. And if we want to go deep, we need to first think about the regulations of it. Otherwise, it would just be too much to control. And
Absolutely.
I agree with that. So, any closing thoughts about those things, like what you said, that what people should do or what people should look forward, and how to like go about it to bring confidence and everything in this?
Yeah, I mean, I think there is a lot of people suffer in silence. So um, just speak out and seek help. Their help is not too far away nowadays. Uh, so my message is seek help, seek help sooner than later. Talk to your trustworthy friends or family members. Find help and don't be shy to talk about these issues. Everyone goes through it. Everyone goes through good times and tough times, but only these tough times will shape you to be the individual who you are. So just keep keep looking out for help. Surround yourself with people who are positive. Yeah, and um, I would encourage more people to come join tech. It's a good thing, especially for India. It has given a lot of riches and benefits to the economy and in terms of job creation. So I would encourage everyone to take up STEM subjects, study science, engineering subjects, learn coding. It changed my life. It changes a lot of people's lives. Um, just embrace it. And even though the new technologies comes with a lot of risk, create a create good mental models to evaluate those risks. So embrace the new things, don't shy away from it, but also just be careful that new things come with a lot of unintended consequences. So just be prepared for that. Yeah, but that's it.
Yeah, that's very interesting, actually. Yeah. So I would also encourage people to seek help and talk more. And if you have a problem, just go out and seek help. It's the most hardest thing, I feel, asking for help for the first time. Then it gets a little easy. It takes a lot of guts and it takes a lot of effort from inside to just ask for the help for the first time, basically. So I would encourage people, yeah, just try and leap out for that thing. Like, go out and seek help if you need, if you feel anything, because it's equally important as your physical health. So yeah, that is it. And thank you everyone for listening. So we'll be coming out with more episodes, and thank you, Neeraj Bhaiya, for coming and like enlightening us with so many things. I was always intrigued by this thing that tech is causing so much problems for mental health. But after understanding what you do, I'm now right now optimistic that tech is also solving a lot for mental health. It's and I can see a positive future for this. Like, there are a lot of things that are coming with Cogniant as well, and other things as well. So please, people, follow these things, and we'll see you in another episode. Bye.
Yeah, thanks for having me. Bye.
Hello, people. If you like this video, please subscribe. I'm trying to reach the goal of 1000 subscribers right now. If the channel reaches 1000 subscribers, it will get monetized. So I need your help in that. And if you like the video, please do consider sharing it with other people as well. Comment below any of your thoughts that you like or that you didn't like, or you want to add something. If you want to chat to me, you can comment or you can DM me on Instagram. I would look forward to it. Thank you for listening, and I'll be coming up with more such episodes. So, yeah, just subscribe. Bye.